Hello, good afternoon, good morning, wherever you are. Hope we find you well. Welcome. We are about to kick off this press briefing, protecting America's youngest children and families from political gridlock and funding freezes. We have 45 minutes. If we need to go to a full hour, we can. I know some folks may need to drop, but we welcome you, welcome your time. Thank you again. My name is Renee Johnston. I am with the P2 Network. I just want to say a few quick reminders. First of all, this is on the record. Everything written, said will be on the record. Secondly, please put your questions either in the Q&A function, and we will see them come in on the panelist side, or wait until all of the remarks are done. We've got a lot of really great speakers who are going to share their perspective on this issue. Wait until they are done speaking, and then I will ask you all to use the raise hand function, and I'll call on you, and we will take questions that way once we get to the Q&A portion. That is it from me. Again, welcome. Thank you, and let's go ahead and get started. And Melissa, from 0 to 3, I will pass it to you.
Thanks so much. And thanks to all of you for joining us today. I wanted to sort of open up by saying that babies are not Republicans or Democrats. Babies don't know if they live in a red state or a blue state, but unfortunately, they and the families and the caregivers that they rely on are paying the price for what has become an ongoing and completely avoidable crisis that is characterized by ongoing chaos around federal funding. So, this is now at least the fifth time in less than a year that families with young children have faced uncertainty and instability about the services that they rely on to meet basic needs. In January last year, there was the executive order freezing funding, and that resulted in mass confusion about whether or not families could continue to access services like Medicaid and Head Start. In the spring, there were massive layoffs and closures of regional HHS offices, which resulted in delays of payments and lack of information to providers. In the summer, Congress passed the largest cuts in history to Medicaid and SNAP, cuts which will hit state budgets next year and after and release a chain reaction of cuts to basic needs programs. And in the fall, there was the longest ever government shutdown, with families facing uncertainty over whether or not they could send their child to Head Start or afford groceries if SNAP payments didn't go out. And that brings us to last week, when there was chaos around the administration's decision to freeze federal funding to 5 blue states, I say between quotes, and to create new administrative hurdles for all states based on unsubstantiated claims. I want to be clear that alleged fraud should always be addressed directly and with precision. And fortunately, states already have tools in place, including strict oversight, regular investigations, and experts who pursue leads based on evidence rather than relying on YouTube videos. Shutting down federal social services and income assistance funding to selected states will hurt babies and not fraudsters. While Friday's court decision means that there is relief for families in the form of a temporary restraining order, this crisis is far from over, as today's speakers will discuss the cumulative and interacting impact of this ongoing and avoidable crisis will destabilize families, push small childcare businesses to close, and damage our broader economy, all while doing nothing to address the ongoing affordability crisis. So, we're having an important conversation today about the future of our country because what happens from birth to age 5 will shape everything that follows. And with that, I want to pass it on to our next speaker.
Misha, over to you.
Good morning. My name is Misha Etzler. I'm a single mother of 4, a parent in CCRC's alternative payment program. I work at the Child Care Resource Center today. For my family, child care support, WIC, and Medi-Cal have been difference between getting by and building a future. Before I found these supports, I was a mom who needed help. I was on TANF and CalWORKs doing everything I could to keep my children safe while trying to find stability. I wasn't looking for a shortcut. I was looking for a way to make my hard work count. Then we found the Child Care Resource Center, and everything began to change. Child care funding through the alternative payment program placed my children in a safe, licensed care so I could work full time. WIC healthy food on our table, Medi-Cal meant I could put my children's health first. These supports helped me transition fully off of TANF and CalWORKs and begin the journey toward buying my first home. My children know that CCRC is our saving grace, the place that lifted their mommy up when I felt I had nothing left, and the reason we are now on the path to buying our very first home today. For my family, these supports are the difference between surviving and building. Childcare keeps me working, WIC keeps nutrition strong, and Medi-Cal keeps care timely. I am a parent who is anxious because these threatened cuts would hurt me and my children and families like mine. When funding is cut, a domino effect begins. Losing childcare leads to missed shifts, income loss, late rent, and instability for children. Providers rely on these subsidies to keep the infant and toddler slots open. Cuts for forced reductions, layoffs, higher tuition, or closures, leaving entire neighborhoods without reliable care. Protecting these funds support the workforce, child development, and provider capacity. This is how independence is built. I am proof that this lifeline works. It made my road possible. Protecting childcare funding and these resources protects working families, providers, and communities. Thank you.
Hi, I'm Donna Sneeringer. I'm the president of the Child Care Resource Center. And I'm happy to be with everyone today under really not so friendly circumstances and really appreciate Misha and her comments. And we are so fortunate to have a long history in Southern California providing services to kids and families through many of the funds that have been threatened last week. And we, along with our state agency partners and colleagues, really jumped in last week quickly, one, to calm fears of our parents and our child care providers who were calling our agency after seeing news stories that put a vital lifeline in their life, in their own lives under question. And we're very grateful for the swift action of our governor and attorney general in filing the suit that happened last week and put a temporary order in place. Just to give some context, in the state of California, more than 3/4 of the recipients of temporary assistance to needing families, which we call CalWORKs in California, are kids. They're babies. They're little kids that their families rely on these dollars to keep their home, to keep their food, and to keep their lives moving forward. We have over 700,000 kids in California on subsidized childcare. About a third of those are paid for with federal dollars. And this kind of disruption, even if it's short term, will really disrupt a very fragile ecosystem of care. I think the other thing that I wanted to highlight and make sure folks are aware of is childcare programs, the businesses that care for children are small businesses. They run on very, very tight financial margins. They don't have float. So if there is a delay in their payment or a gap in payments, it threatens their ability to operate. We heard from providers last week who were worried that we would not make our payments this month. They were worried that they would have to tell families they couldn't provide care, that they couldn't keep their doors open, that they would have to lay off their teaching staff. And it's important to understand that the subsidized system is interwoven with the entire childcare system. So while the threats to funding are targeting families receiving these services, the industry is threatened with these resources being paused or taken away. These layoffs and classroom closures impact all families using childcare, not just families in the subsidized system. If classrooms close, everyone loses the service. And that then has a rippling impact of cascading into our broader economy. Everyone who has young children and are at work are there because someone is watching their children and they're in a childcare program. Think about all of the essential services. We don't have to go too far back in our memory to COVID, when childcare became incredibly important to make sure our hospitals were open, our grocery stores were open, our law enforcement was happening. And that's true today too. And disrupting these services can upend entire communities and entire economies. Short-term delays are not just short-term. They will close businesses. They will have families losing jobs, potentially losing their housing, and the consequences will be long term because there aren't the resources to bring people back. So we really implore folks to understand that there's a broader economic consequence to this. This has a ripple effect across our entire childcare system for all families and across our economy who rely on their workforce to be able to be there on the shifts they're assigned to. Thank you.
Thanks, Donna. I'll jump in. Wendy Chun-Hoon. I'm the president of the Center for Law and Social Policy, or CLASP. And thanks to all the journalists who've joined to learn more about this crisis facing our nation's youngest kids and their families. Really a crisis that's manufactured by the Trump administration as part of a concerted effort to use immigrants as pawns in advancing a political agenda. So we should make no mistake, the funding freezes that were announced last week and the targeting of immigrant families and providers are a deliberate effort to undermine families with low incomes, families of color, immigrant communities, by really instilling fear and chaos and disrupting essential services, as Donna was just saying, and programs. And doing so, as we've all just said, really harms our youngest children, especially babies and toddlers. In addition, the attack on immigrants damages an already strained childcare sector, which includes many immigrant providers who play a critical role in delivering culturally competent care to hundreds of thousands of our kids. What's also concerning is the administration's use of misinformation and social media to seed mass confusion in rolling out these policy changes, all of which creates this uncertainty about what the path ahead is. The funding freezes affect 3 essential programs designed to support families' ability to meet their basic needs, as Misha was talking about. The first program is the Temporary Assistance for Needy Families, or TANF. Second program is the Social Services Block Grant, or SSBG. And the third is the Child Care and Development Block Grant, or CCDF. And so first, just a bit about TANF. TANF provides temporary monthly cash assistance, child care services, and work activities and support to families with very low incomes. Again, this is what Misha was talking about with CalWORKs. So threats to TANF funding are going to be felt most by the children and families who already face an affordability crisis and who rely on other critical public benefit programs like SNAP or food assistance and Medicaid or health assistance. And unfortunately, many of these benefit programs are threatened because of the changes that were required last summer under H.R. 1 or the Massive Reconciliation Package, which pushed through on the narrowest of margins by the House and Senate Republicans in the White House. Switching gears a bit, the Child Care and Development Fund, CCDF, provides a lifeline for families with low incomes. As many have talked about already, if the proposed funding freezes moves forward in all 5 states, more than 300,000 children could lose access to child care assistance. And so arbitrarily withholding federal funds from these 5 states is illegal, it's reckless, it's cruel. While instances of fraud, of course, should be taken seriously, we haven't seen any evidence proving allegations of childcare fraud. I should also mention that these programs already have extensive mechanisms to ensure integrity, ranging from detailed state plans outlining their use of federal resources to extensive reporting and auditing requirements. Those are already built in. Friday's temporary restraining order pausing the federal funding freeze offered some degree of relief, but we expect a ruling in the next 2 weeks about the longer term outlook. So everybody is still on pins and needles. Beyond the threat to these 5 states, childcare programs nationwide could experience funding delays because of, quote, the defend the spend requirement that all states provide additional justification to access CCDF funds, which is now in effect, as Melissa had mentioned at the top. Sadly, the White House has already signaled it won't stop with currently frozen programs, especially if the courts or Congress don't hold the administration accountable. We have repeatedly seen this administration scapegoat immigrants to weaken critical nutrition and health supports for low-income communities. I just want to end on a positive note and a bit of contrast. I want to uplift some bright spots across the country, really in contrast to the harm being done by the Trump administration. 2 examples. Last fall, New Mexico launched a universal childcare program And just last week, we learned of Governor Hochul and Mayor Mamdani's plans to significantly expand childcare access in New York, which is one of the states implicated by the funding freeze. So while the federal government is failing children and families and undermining states' ability to implement and provide care, leading states like New Mexico, New York, and others are making important improvements and expansions to support kids and families. Here at CLASP, the needs of kids and families and childcare providers and immigrants and people of color are really central to our mission. Unfortunately, these are the folks that are the primary targets of the Trump administration's policy shifts over the past year. So along with our partner organizations on this call and beyond, we know that what is needed to ensure success for families with young children in this country is really about bold steps like those taken in New Mexico and New York, along with increased federal funding that is truly going to support families. The administration's heartless strategy of abruptly stripping away resources without considering the damaging consequences is the exact opposite of what families with young children, and especially those who have been pushed to the margins, including immigrants and communities of color, exactly opposite of what they need to thrive. Thank you, and I'm passing it to Angelica.
Good morning. Thank you so much for allowing me to be here and being able to share my story. My name is Angelica Fuentes. I'm a mother of 5. I am currently a CCRC parent, and without CCRC, I would not have been able to go on the journey that I went on and help my family succeed and grow as well. During COVID, I got pregnant with my 5th child and had no idea what I was going to do for childcare. I had to quit my job of 8 years working as a behavioral therapist because my son, my son got diagnosed with ADHD, and he had suicidal ideations and was hospitalized in a mental facility. And at that point, I quit my job, focused on my kids, and decided to go back to school. Well, I had no childcare. I didn't know what I was going to do. I only needed one more class to transfer to a university. And I started at Los Angeles Valley College. And I had no idea what I was going to do. I was ready to take the baby with me to school because I had no childcare, but I knew this was something that I needed to do. I needed to finish my education and move my family forward. And literally a week before I started school, I got approved for CCRC on a lottery system. And I quickly looked for childcare. I got my daughter into an amazing daycare. She was then diagnosed with ASD. She is on the spectrum. And thank God that school was just the perfect fit for her. And while I was going through services and therapy for her, I was going to school as well. Well, I was able to complete my studies, and from Los Angeles Valley College, I transferred to Cal State University of Northridge, and I recently graduated last year with a double major in psychology and Chicano studies. And I'm still working right now on my education because I'm trying to get a credential. I am hoping to teach in either a high school or middle school setting because I think it's education is very valuable and there are not enough teachers right now. And while many people are running away from the fire, I'm running towards it because I recognize how valuable it is to be in the education system. And with my education, my kids were motivated. I have one in college right now trying to become a vet, one trying to, she's in political science, trying to become a lawyer. I have my 12-year-old who had ADHD, still has ADHD. He's in robotics. I have another one in dance, and the 5-year-old with ASD, she is thriving in speech and language. And without CCRC, I would have never been able to do any of this and move forward with my kids and my families. And there's a great fear right now, and I'm so glad to have been able to speak today because I, like many parents, if I didn't have this, I would have not been able to continue this journey, to do this journey. I was at a level of desperation where I was willing to take the baby with me to class. I'm like, I'm gonna breastfeed. I don't care. I'm gonna have the baby with me. I was ready to do this. So imagine all those families with those levels of desperation, of uncertainty. It causes chaos. I have been there where all these financial struggles causes so much stress, and these families can barely afford to live, to eat. I know half of everything that I work for goes to food, just to food alone, to food, to bills, let alone if you strip away the childcare, what am I going to do with my 5-year-old? If I didn't have that, I wouldn't be able to continue on my journey to continue with my education and to motivate my kids to continue their education as well and to help other families as well. So I'm here as a concerned parent as well, sharing my story, personal, deep details. But there are many other families in my shoes as well who are struggling. And maybe not all results are equal, but a lot of families need this and rely on this just to move forward, to be able to go to work, to be able to have some type of sanity, to be able to breathe. Because when you're in that position, you are literally underwater and cannot breathe. And that can make or break a family and causes families, to do unspeakable things, like I said, out of desperation. And as far as for the childcare, what are families going to do just to survive without this childcare? This is very crucial. So I am hoping today that policymakers will listen to these families with young kids and see, like many have said, there will be a domino effect. How are we supposed to move our children forward, move forward as a society, move forward in succeeding, watching families succeed to get out of these positions if they don't have the same opportunity that I had just by having childcare access. Thank you so much. And I have so many other questions, but like I said, this has impacted me in a positive manner and not only improved the quality of the life for my family, but for my children's future as well, just having access to CCRC. Thank you.
Hello, I'm Phil Fisher. I'm the director of the Stanford Center on Early Childhood, which houses the Rapid Survey. The Rapid Survey is a group of surveys, actually, including 2 national surveys of households with young children and the early care and education workforce. The surveys are nonpartisan, and what I'm going to be doing is just furnishing some facts that we've been gathering from households with young children and the early care and education workforce. The survey began at the outset of the pandemic to document the experiences that adults in the lives of young children would be going through, and has continued now on a monthly basis over the last 5+ years. I want to talk about what we're learning about issues of affordability from both parents and the early care and education workforce. And I want to just provide a group of facts related to this. First and foremost, in the time over the last 5+ years since the spring of 2020 that we've been gathering information about affordability, there's never been a time when we saw less than 1 in 4 families saying they couldn't afford on a monthly basis to pay for basic needs. However, those numbers have really changed dramatically over the last 4 or 5 months. In October, we recorded our highest rates of what we call material hardship, which is the difficulty to afford basic needs. 60% of families in our survey, which spans the country, includes families in all regions and across all economic groups. 60% said they couldn't afford at least one basic need. And in November and October, around November and December, we saw rates of 55%. So these rates are considerably higher. I will note that there was a period of time during the pandemic when the rates dropped considerably, and that was the result of, or at least coincided with, when all of the pandemic relief policies were in place for families. So we do see that policies can have an impact on the well-being and the economic circumstances of families. But at present, we're actually seeing rates that are considerably higher than we ever saw during the pandemic, with more than half of all families consistently reporting that they can't pay for things. The top of the list is utilities that parents can't pay for, but we heard from a number of other speakers that food is next on the list. So more than 1 in 4 families each month are saying that they can't afford food. Healthcare, housing, childcare are all up there as well. Our survey of the early care and education workforce shows even higher rates of difficulties with affordability than we're seeing among families, which means that the people that we rely on to take care of our children, provide nurturing and quality care so that parents can work, contribute to the economy, are also struggling with paying for basic needs. I want to highlight the impact that these difficulties paying for basic needs has on households. So we have reported and recorded consistently since 2020 that when parents and other adults can't pay for basic needs, that we see increases in the levels of distress among the adults in children's lives. Most recently, 72% of parents who take our survey report that they're experiencing distress. That includes people reporting very high rates of stress, of anxiety, of loneliness, and depression. Again, we see these also reflected in the early care and education workforce, and it's directly associated with people reporting that they can't pay for basic needs. And then subsequently, when adults report that they're distressed, we see significant impacts on their reports of children's distress, both in terms of things like worrying and fearfulness, but also in terms of things like acting out, being defiant, and not being willing to go along with what adults want. We also see that the parents' distress and adults' distress is impacting children's developmental progress. So this chain reaction from the affordability issues that are becoming endemic, but yet could be addressed through policy, are really having this ripple effect to adults and then on to children. As I mentioned, we collect quotes in addition to gathering quantitative data. And so I'll read a few of these that illustrate the points that I've been making. First, in terms of hardship, a parent in Florida reports to us a huge portion of our monthly budget goes just to keeping a roof over our heads, leaving very little for savings, grocery, transportation, or emergencies. The pressure to stay housed is constant, and it forces tough trade-offs, sometimes delaying bills, cutting back on essentials, or skipping activities for kids. The stress of possibly not being able to afford next month's rent is a weight we carry daily. Parents also report things like difficulty paying for diapers and formula, which are on the rise, and we consistently see concerns about rising prices. One parent in Illinois said our electricity went up in cost, and we went from around 200 to around 600 a month, which is an insane increase. That's like having another mortgage payment or 2 car payments added. One parent in response to this says, and I think this is a very common comment, the stress weighs me down every day. I feel overwhelmed, anxious, depressed. My sleep is horrible. I'm scattered and forgetful. I feel like I can't do anything well. That's from a parent in Wisconsin. So these issues that have been talked about by other speakers are really coming through in numbers that we're collecting from families in terms of these basic affordability issues. And what we see that's been reported elsewhere in the media is that the rising cost of living is making affordability an extremely difficult challenge. When we're here to talk about the things today that could further impact families' ability to procure funding for critical needs like childcare, our expectation is that we'll see these challenges continue to grow in terms of affordability, which will then have the ripple effects that I've been talking about continue to increase as well. And yet we know that policy, from what we saw during the pandemic, can take a big bite out of these issues if we show the self-discipline to really make sure that these things are happening. Thank you.
Good afternoon, everyone. Phil, thank you so much. You have so beautifully highlighted exactly the point that I think it's so important to emphasize, in that All of these affordability issues are especially and almost twice over impacting our childcare workforce and our early childhood and care and education industry. My name is Donna Anderson. I am the executive director at the New York Early Childhood Professional Development Institute. So here to represent a little bit of New York as well, the perspective. So just thinking about these funds that are temporarily unfrozen and temporarily frozen. In New York, that means about 200,000 families receive direct cash assistance to help cover housing, food, and other necessities. We spent $638 million in childcare subsidies last year to help low-income parents as they work and attend school. $93 million through the Social Services Block Grant to support foster care, child welfare, and other services aimed at preventing abuse and neglect. And more than 150,000 children in New York State receive child care subsidy or child care assistance. About 63% of those are in New York City itself. And I think what's important to remember is that funding instability doesn't just disrupt systems, it disrupts relationships. And we know that stable, trusting relationships with caregivers are foundational to healthy development. And instability in early childhood can really have lifelong consequences. When programs close, families lose their assistance, children lose trusted caregivers, families experience heightened stress, as we've already heard about, and generally trust in our system erodes. New York's early childhood workforce themselves are also already very stretched and in crisis. We're facing persistent staffing shortages due to low wages, and we then see also high turnover. When it comes to staffing shortages, almost 60% of our census tracts in New York State are considered childcare deserts, where there isn't enough childcare to meet demand. This is due in part to a lack of sufficient early childhood care and education providers themselves, the people to take care of our youngest learners. The staff shortage is also due in part to low compensation and benefits. The median wage for childcare providers is more than $20,000 less than the median wage for all New York workers overall. And of course, that means that we often see reports and have seen reports of providers leaving the industry to go to work in retail or fast food because they can earn higher wages and have better benefits in those industries. So these are some of the longstanding challenges that New York has been tackling, but really are being compounded into immediate threats to stability with funding freezes like this. New York has made some historic investments in affordable childcare under our current governor, Governor Hochul, and that has dramatically expanded access for families. It's important to highlight. Those investments rely heavily on federal partnership and funding. 75% of childcare subsidies in New York come from federal funding. That means the state has, over the last few years, been able to double funding for the Child Care Assistance Program. It's doubled the number of children served by our voucher program. It's expanded eligibility by raising the income limits to the maximum allowed under federal law. And in New York, that means for a family of four, they can earn up to $113,000 annually and still qualify for child care assistance. And they've also been able to increase reimbursement rates for providers, which has been desperately needed in order to reduce somewhat this crisis that is continuing to be ongoing. New York made a commitment to doing what we know works. We invested in families and providers, and yet much remains to be done. The federal funding freeze threatens to really undo this progress. We've already heard what happens when we don't have a stable stream of funding. Families can't depend on childcare, so they might be unable to work, to go to school. On the other side of this, providers can't depend on the revenue and so may be forced to close. And I think the point was made earlier that when that childcare assistance provides revenue to programs that serve all children and not just children on subsidy. And so when those classrooms close, all children lose, all families are losing out on that vital service. In New York State, 79% of providers serve children who have childcare subsidy. Subsidies are therefore that fundamental pillar. The revenue supports the program so they can serve everyone, no matter whether they qualify or not. We know that early childhood works for children and families. We also know that the quality of that early childhood care and education depends on the skill, stability, and support of the adults who provide it. So we really need to invest in the workforce accordingly. Instead of operating in this crisis mode that moves from instability to instability, we need to invest in what works to recruit, retain, support, and strengthen qualified providers so that New York's and in fact all of our states and all across the country, so that our youngest learners can thrive. So really, we urge policymakers to prioritize long-term sustainable investment in the early childhood workforce and systems that's really essential for our children's overall success. And I think I'm sending it over now to Melissa.
Thanks. I want to close by giving you a sense of the extent of the potential harm of the proposed freeze and why the impact of both the most recent chaos and also the cumulative and interacting chaos could have effects that go well beyond the temporary pause. So, because California and New York are the two states with the highest number of young children receiving TANF, this is 55% of all children under 6 who receive TANF and 24% of all children under 6 who receive the Child Care Development Fund. So that is just for the states represented on this call, the scope of how far-reaching this impact could be. And over the next week, extreme cold is going to be coming to the US. We might even see records broken across the Midwest, the Great Lakes, and the Northeast, with below freezing temperatures that could even reach the Gulf Coast and northern Florida. And I mentioned earlier, babies don't know if they live in a blue or red state, but they will know if they are evicted this winter. Babies will know if their parents can't afford to turn on the heat, and babies will know if their parents are stressed out because their childcare is closed. And the science is clear. The first 5 years are a period of rapid development for children. Babies thrive in stable, nurturing environments with predictable routines. And conversely, when that family's routine is disrupted, and importantly, if parents fear it will be and carry the stress and anxiety back home. So that means this seesawing back and forth, this chaos and confusion, before money even changes hands or is stopped, the constant environment of chaos and confusion affects parents, and via parents, it affects the development of their babies. And during this period, that stress shapes how babies' brains and bodies develop at a time when the foundation for everything is coming together for them. So, in short, fear and anxiety isn't good for babies, and it's not a way to lead. Congress and the administration need to stop playing political games with the funding that helps babies and their families thrive. It's time that our nation invests in families, and that means that the administration should restore any frozen funding, both to the 5 states that are most immediately impacted, but also we want them to be making sure that we're not taking steps to make it more and more difficult for families. While the court stepped in to pause the freeze, it's only temporary, and families need to know these programs won't go away. Secondly, at the end of this month, funding for many federal programs will expire unless Congress acts. So Congress needs to pass the appropriations bill to fund programs that provide for childcare, Head Start, healthcare, and including infant and early childhood mental health services. And finally, we should be proactive. We should be investing in early childhood systems, not throwing them into further chaos. We have the knowledge and the tools to prevent harm, and now we need the political will. I'll turn it back to
Excellent. Thank you to all of our speakers. That was a lot of really great information and stories, and we really, really appreciate that, your remarks and the data and everything. So we will open it up to questions now. Please use the raise hand function. I will prioritize calling on media individuals first, but anyone's welcome to enter a question, ask a question. Okay, let's see. Daisy Nguyen, I see your hand up. You can come off mute.
Okay, hi. Thank you for taking my questions. It's for Angelica. You mentioned you get CCRC benefits. Could you specify exactly what it is that you get in terms of childcare assistance?
I'm sorry, what do you mean, like what I get? Like my how it works, how I got in, like if I was on TANF.
Right. Was it CalWorks?
No, I was not on CalWorks or TANF. When I was pregnant, as soon as I was pregnant, I applied for the program. CCRC is very how do I explain? It's very strict on the process. So I had CCRC prior many years ago, and then I actually got I lost my services because I didn't complete like a certain form for income on time, so I lost it. So during the pandemic, as soon as I found out I was pregnant, I applied again and was like on a waiting list. So I was fortunate enough that something opened up in that waiting list where they were able to give me a spot in the childcare. But I had a very short window where I had to find the childcare. I had to submit all my documents. I had to show proof of the income level that we were in. And we barely met the criteria because of our income level. Because, like I said, I have 5 kids. And at the time, my son, my daughter were not working. And now the only reason why we're surviving is because my son and daughter are working and they're able to contribute to the household income.
Donna, I see your hand up. You want to weigh in here?
I was just going
Donna
to
Sneeringer.
add, yeah, I was just going to add, Daisy, the enrollment that Angelica was involved in was largely because of Governor Newsom's expansion of state funding for childcare subsidies. Similar to New York, we have gone through quite a few years of expansion, which has now sadly stopped because the state is looking at the realities of HR 1. And at the time of the announced expansion, Governor Newsom had promised 200,000 new childcare spaces in California. We're stalled right now at about 146,000 and on hold because the state is hunkered down in preparation for the impacts of the major reductions that were agreed to in HR 1, which Melissa mentioned earlier.
Thank you. And if you could mention the outlet or organization that you're with once you come off mute for those coming up next, we'd really appreciate that. Forgot to mention that. Let's see. Amber Summers, I see your hand up.
Hi. So I'm Amber Summers. I'm from Illinois. I just wanted to add that I personally had TNF cash assistance benefits, and without those benefits, I would not have been able to pay rent or buy household items or diapers or wipes or formula for my child.
Thank you for sharing that. Yeah. Does anyone else want to raise their hand for a question? Again, we do have some extra time, I think, with the speakers, if anyone else would like to ask a question. I'll ask a quick question that I think you all touched on, but maybe we could just go back over again of what are the immediate steps that you think could be taken to help restore stability for families? Just if anyone from the speaker list wants to take that on real quick.
Well, first they can unfreeze the funds. I mean, obviously there's a court temporary injunction, but eventually there's going to have to be a decision about whether or not this continues. And with recognition of both the science and the family stories and experiences of the havoc that this is wreaking, and in interaction with and building upon havoc that has been wreaked over the past year, the first thing is to do no harm. And so to unfreeze the funds. The second is, there's an appropriations bill for labor, health and human services and education still under discussion. For Congress to pass that and the president to sign it so that there is stable funding, not just another continuing resolution. And then third is listen to the families and providers, the ones on this call, the ones across the country. Listen to the data. Stanford and the rapid EC Center, there's data every single month that is showing the level of the affordability crisis, and also, to Phil's point, the role of policy in mitigating it. These dollars matter for families. And that when you take steps like this, whether it's in the form of an executive order or closing regional offices or legislation or a shutdown or a funding freeze, you can put it under any name or any context, the impact is the same on families. They don't know why their funding isn't coming through. They don't know why there's chaos and confusion, but they know they can't meet rent and they know that their childcare center closed. And we have the evidence that policies and these investments work. And so for Congress to get serious about actually investing in families, both supporting states like New Mexico and New York that have and are taking steps forward, as well as proactively investing and making it easier for families to access the basic needs that they need.
I'd like to just elaborate on what Melissa said, with some just a little bit more data from this nonpartisan survey. We have found consistently that in addition to just general affordability issues, that another thing that weighs heavily both on families and on the early care and education workforce is unpredictability. And so one of the things that I think we've all spoken about is how volatile things are in terms of the policy landscape, as well as just more generally in terms of the economic circumstances of adults in the lives of young children. Our data consistently show that uncertainty or unpredictability around basic needs, around affordability, is something that increases distress among parents and adults and then gets passed on to children in the same kind of way, the same mechanisms that we see when it's just about the overall affordability. And so I think in terms of the well-being of children, some of the sort of volatility of these policies coming in, coming out, getting challenged in court, then getting reinstated or getting taken back, those things are also having additional impacts. This is not just our data. There is really a tremendous amount of scientific evidence that's been collected over decades that shows that unpredictability, when it's extreme, not small amounts, which are actually fine and actually help children to develop, but when unpredictability is chronic and extreme, it compromises children's development, not only at a social and emotional level, but even at a very biological level in terms of the underlying stress regulatory systems that are very vulnerable when children are young and therefore have lifelong consequences in terms of the long-term impact. So I just want to highlight that we shouldn't just be thinking about what policies can do to make sure that things are affordable, but that we should also be thinking from a very bipartisan perspective about stability and predictability and how we can make sure that that's present in the lives of adults who take care of young children.
Right. The
Could I just
scandal is the
reinforce?
instability. Go ahead.
Could I just reinforce something that Melissa and Phil both just said, which is for any state administrations on the line, for any advocates in the states, over communicating with folks to make sure that they know their rights, that they know that they're still eligible for these benefits, what's going on. So that proactive communication counts in a moment where there is very intentional seeding of chaos and instability.
Right. The scandal here is the preventable harm being done to babies and their families. That is the scandal. And I
Thank
will
you
note
all.
that there are plenty of rural areas and red areas in blue states. And again, families don't know the cause of this, but if you're in a rural area and your funding has been frozen in New York and California, in Minnesota, etc., again, babies don't have politics. They have basic needs and mental health and a need for connections and stability. And so when we're punishing babies and it's not doing anything to prevent the issues that we're being told are at the center of this. The people who are the getting hurt the most are our youngest children who know nothing about what's happening.
I actually would like to add to that. I'm from a rural area in Illinois, and I'm seeing so many people around me that, well, what's going to happen with funding? And a friend of mine just had a baby and she didn't get paid maternity leave. So now she needs cash assistance to buy diapers and wipes and formula. And everyone's like, what's going to go, what's happening? What's going on with the cash assistance? What are we going to do? We're in a rural area and I know so many people that are personally affected by this.
Absolutely. Last call for questions. Please raise your hand if you have any. Okay. Well, hearing none, we'll go ahead and wrap up. Thank you to our speakers for their expertise and insight and lived experiences and stories. We really appreciate it. Thank you to all of you who joined. We really appreciate your time. If you have any questions, please feel free to reach out to us. And we're happy to connect you with these speakers or answer any follow-up questions that you may have. Thank you again, is how I'm going to end. And everybody stay safe out there. Thanks so much.
Thank you. Have a
Bye,
good
all.
day. Thank you.
Thank you.